I'm Debbie Logan, and I'm with the Mississippi Office of Nursing Workforce, and I have the privilege, and I say that with all honesty, it's a real privilege to coordinate and direct the Dedicated Education Union project for our state and the grant. And we're very happy that you're all here, and this is an opportunity to learn about preceptors and clinical facilitators. The real role is called clinical facilitators, but it's a very much a thread of preceptorship and mentorship throughout the role, and I think you'll find those responsibilities will remind you of that role. We received in Mississippi about a year and a half ago grant funding from the Robert Wood Johnson Foundation, the Northwest Health Foundation, in what's called a Partners in Nursing endeavor. And also it required that we have match money from different groups in our state, and we were very fortunate that a number of hospitals and schools of nursing were willing to come to the table and put that match money there. I want to give a special thanks to Hines Community College School of Nursing and Dr. Libby Mahaffey and Ms. Deborah Spring, as they were willing to step to the line and be the recipient of the grant. And their foundation is the grant recipient, and then they have worked with us as we coordinated this throughout the state. And I want us as a state to really to applaud ourselves, because we have stepped into something that is very unique. It was originally started in Australia and then in Oregon, and we have taken it in Mississippi and run with it and done an outstanding job. We are videoing the conference today, and the reason for that video is so that we can continue to train clinical facilitators, because we know this is going to grow and be stronger and stronger. So you're going to hear from several people today. You're going to hear from Dr. Walton from the University Medical Center. You're going to hear from Ms. Deborah Spring from Hines Community College, Dr. Beth Twiner from Mississippi College, and then Dr. Mahaffey will close the conference at the end. We want you to ask us questions. It's been about a little over a year that we've had this going. We've actually just finished our second semester of DEUs. So we've learned a lot, and I think that's important that you know that what we learn and what you tell us from the experiences, we are using, and we have made changes already, and that's just part of the way the program works so well. I want to tell you about a website. It's called www.iteachnursingms.org. Your coordinator for the project at your facility has got passwords, and we'll give you a password, because that website, you can get to portions of that website, but most of what's on there related to DEUs we have password protected, because we are using that as a way for you all as clinical facilitators. You can even ask questions on there, but where we put things that we believe will help you in the work you're doing with the students. Now, I've been in nursing a long time, and I believe that this is one of the greatest programs that I have ever seen, because it enhances our student nurses' experience, where those nurses at the bedside, who know more than anybody about what's going on with their patients, have the privilege and opportunity of sharing that knowledge with students. And my favorite story about our DEU is when Dr. Sheila Keller is our evaluator, and when she and I have made visits to different schools, and the students have looked at us and said, now before you leave this room, you promise me I get to go back to a DEU in my next rotation. And when students say that, that tells you they're getting the information and the experience they need. So I'm going to end what I have to say, unless anybody has any questions about the DEU grant or the project, and turn it over to Dr. Pat Walton.
Thank you, Debbie. We're a small group today, but it is so good to see all of you here. What I would like to do to begin with is just if we'll go around the room, and if you'll introduce yourself, that will help me to see who is here and help us to direct some of our discussion today. So could we start here? Your name and what agency you're from?
Patty Isbell, and I work at University.
Patty, and what floor are you on?
Forsyth.
Forsyth, okay. Glad to have you.
Good morning, I'm Sarita Howard, and I'm one of the clinical facilitators at CMC on 5 Southeast.
CMMC representative, very good.
Audrey Marion, instructor at Hines.
All right, Audrey, glad to have you.
Janice Tillman, CMC 5 Southwest.
Edgar Miller, nurse manager, 5 Southwest Central.
CMMC is well represented.
Shauna Gillespie, I'm on the board of the University.
Thank you. And we'll move on to the back row.
Linda Banks, instructor at Hines, and students I have are at St. Dominic on 6.
I'm Dr. Olin Hines, one of the instructors, and my students are going to be in the first DUs for practical nursing at Pleasant Hills.
Wonderful. So our practical nursing program, see how we've expanded our DBU model. Excellent.
Pam Ray's from Hines, and the ADN director at Nursing Elliott. Maxine Cron, Hines, district director of practical nursing.
See you, Maxine.
And Deborah Sprain, Hines, assistant clinical nurse.
And Libby Mahaffey in the back. And again, I'm Pat Waltman, and I'm from the University of Mississippi Medical Center School of Nursing. And again, thank you so much for being here today. You know, a year ago when we looked at this dedicated education unit model, we really didn't know that much about it other than what we had read in the literature. But we were very excited about it at that time, about the opportunity to create something new and exciting for the state of Mississippi and something that would improve the learning environment for our students. So our School of Nursing has paired with University of Mississippi Healthcare. That's our clinical partner, and we have dedicated education units on 4 North and 4 South. And I will have to say that in the year and a half that we have established the DEU, both the students and the staff and the faculty as well, we've just been overwhelmed at the positive response we have had to the DEU model. It does create the optimal learning environment for students, and that's what it's about, but not just that. It also creates an optimal education environment. It creates professional growth and development for the staff nurses, and it creates a unit that is set aside for excellence in education and practice and quality patient care. So as you think about a DEU model, it's just not working one-on-one with a student. It's the entire unit, the entire agency, focusing with a commitment on educating the nurses of the future. So we're very pleased to be a part of this. What I want to do today is talk with you a little bit about the roles and the responsibilities of the key people in the dedicated education unit. And what we have learned in this last year and a half is the model is out there, the roles and the responsibilities have been fairly well laid out, but for each of the partnerships that have been formed through the state DEU project, we've learned that they've been modified a little bit by each partner group based on the needs of the School of Nursing, based on the resources that are available in the clinical agency. So what we have are 5 DEU partnerships across the state that are unique and they're individualized based on their student population, the school, and the